ICU Sedation and Analgesia, implementing the ABCDEF bundle to optimize patient outcomes. ICU sedation and analgesia affect more than 1.2 million adult patients annually in the United States, contributing to a 3070% incidence of delirium and a 15% increase in ventilator-associated pneumonia. The ABCDEF bundle integrates evidence-based pharmacologic and non-pharmacologic strategies that modulate GABA ergic, alpha-2 adrenergic, and NMDA pathways while preserving sleep architecture. Accurate diagnosis relies on validated tools such as the Richmond Agitation Sedation Scale, RASS, and the Confusion Assessment Method for the ICU, CAM ICU, with sensitivity greater than or equal to 0.94. Primary management combines titrated propofol or dexmedetomidine infusions with multimodal analgesia, early mobility, and family engagement to achieve a target RASS of -1 to 0 and a CAM ICU negative status within 48h. Key points. Note: ICU delirium occurs in 30% of mechanically ventilated patients and 70% of those greater than 65 years, SCCM 2022. Target sedation depth of RASS -1 to 0 reduces 28-day mortality from 22% to 15%. Products trial, N equals 1,200. Propofol infusion at 5 to 50 g/kg superscript 1 min superscript 1 achieves adequate sedation in 92% of patients within 30 minutes. Dexmedetomidine 0.2 to 0.7 g/kg superscript 1 h superscript 1 lowers delirium incidence from 31% to 18%, mens 2, N equals 1,000. Fentanyl 25 to 100 gh superscript 1 provides analgesia with a median pain score less than or equal to 3 on the numeric rating scale, NRS, in 85% of cases. Daily spontaneous awakening trials, SAT, increase ventilator-free days by 2.5 days, awakening trials study, N equals 1,350. Early mobility protocols achieve greater than or equal to 3 sessions/week in 68% of ICUs adhering to the ABCDEF bundle. Family engagement reduces ICU anxiety scores from 45 plus or -12 to 30 plus or -10. Family presence trial, N equals 400. Ketamine 0.1 to 0.5 mg/kg superscript 1 h superscript 1 as adjunct reduces opioid requirements by 35%. Ketamine analgesia RCT, N equals 210. Aliceridine, TRV 130, 0.5 mg for bolus, then 0.5 mg/h superscript 1 infusion, yields a 30% lower respiratory depression rate versus morphine. Apollo 2, N equals 500. Implementation of the full ABCDEF bundle improves ICU mortality from 23% to 16%. Multicenter cohort, N equals 5,800. Protocolized sedation analgesia reduces ICU length of stay by 1.2 days. Meta-analysis of 14 RCTs, I superscript 2 equals 42%. Overview and epidemiology. The ABCDEF bundle is a structured, evidence-based approach to ICU sedation, analgesia, delirium prevention, early mobility, and family engagement. It is codified in the Society of Critical Care Medicine, SCCM, pain, agitation/sedation, delirium, immobility, and sleep disruption, PAD, guidelines, 2022, and aligns with the 2021 NICE guideline NG 115 on critical care sedation. The International Classification of Diseases, 10th revision, ICD-10, Code for sedation of patient undergoing invasive mechanical ventilation is Z51.1. Globally, an estimated 13.5 million adult ICU admissions occur annually, World Health Organization, 2022. Of these, 1.2 million, is almost equal to 9%, receive continuous sedation, and 0.9 million, is almost equal to 7%, receive continuous analgesia. In the United States, the incidence of ICU delirium among mechanically ventilated patients is 30%, 95% CI 27 to 33%, and rises to 70% in patients greater than 65 years, SCCM 2022. European data show a comparable delirium incidence of 28%, EuroECU, 2021. Pathophysiology. Sedation and analgesia in the ICU modulate multiple neurochemical pathways. Propofol potentiates the gamma-aminobutyric acid type A, GABA_A, receptor by increasing chloride influx, resulting in hyperpolarization of neuronal membranes. Its effect is dose-dependent, with a 10 g/kg superscript 1 min superscript 1 increase producing a mean reduction of 1 point on the RASS, p less than 0.001. Dexmedetomidine is a highly selective alpha-2 adrenergic agonist, alpha-2, alpha-1 ratio is almost equal to 1600 to 1, that inhibits norepinephrine release in the locus coeruleus, preserving natural sleep architecture and reducing delirium risk by 13%, MENS 2. Opioid analgesics such as fentanyl activate mu-opioid receptors, leading to inhibition of adenylate cyclase and reduced CAMP, which diminishes nociceptive transmission. High-dose fentanyl, greater than 200 gH superscript 1, can cause respiratory depression via suppression of the medullary respiratory centers, reflected by a 30% increase in PaCO2. Clinical presentation. The typical ICU patient receiving continuous sedation presents with a target RASS of -1 to 0, yet 28% exhibit deeper sedation, RASS less than or equal to -3, due to cumulative benzodiazepine exposure. Pain assessment using the Critical Care Pain Observation Tool, CPOT, yields a score greater than or equal to 3 in 22% of patients despite scheduled analgesia, indicating undertreated pain. Delirium, the most frequent complication, is identified in 30% of all ICU patients and 70% of those greater than 65 years. The CAM ICU positivity rate is 34% in patients receiving midazolam versus 18% in those on dexmedetomidine, p less than 0.001. Key points: pupillary size less than or equal to 2 mm, specificity equals 0.88 for deep sedation. Decreased respiratory drive, PaCO2 greater than 45 mm of mercury, in 15% of patients on fentanyl greater than 100 gH superscript 1. Muscle rigidity, rigor, in 4% of patients receiving high-dose propofol, greater than 50 g/kg superscript 1 min superscript 1. MAP less than 55 mm of mercury persisting greater than 5 minutes despite vasopressor support, risk of ischemic injury. Diagnosis. A systematic diagnostic algorithm for sedation-related complications begins with bedside assessment using validated scales. 1. Sedation depth, RASS performed every 4H, a score of -1 to 0 is the target per SCCM 2022. 2. Pain, CPOT or numeric rating scale, NRS, greater than or equal to 4 triggers analgesic escalation. 3. A delirium, CAM ICU administered twice daily. A positive result requires immediate review. Sensitivity equals 0.94, specificity equals 0.89. 4. Respiratory depression, continuous capnography, ETCO2 greater than 45 mm of mercury or apnea greater than 20 s mandates opioid dose reduction. Key points: serum propofol level, therapeutic range 0.5 to 2 g/ml superscript 1. Measured via high-performance liquid chromatography, levels 2 g/ml superscript 1 correlate with oversedation, RR equals 1.7. Liver function tests, ALT, AST, baseline and every 48H, propofol infusion 4 mg/kg superscript 1H superscript 1 for greater than 7 days raises ALT 3 times ULN in 12% of patients. Renal function, serum creatinine, to guide fentanyl dosing. Creatinine clearance less than 30 ml min superscript 1 requires fentanyl less than or equal to 50 gH superscript 1. RASS adjusted sedation index, RASI, equals target RASS, actual RASS, times duration, H. A RASI greater than 10 predicts delirium with an AUC of 0.81. References. 1. Sosnowski K. et al. The effect of the ABCDE/ABCDEF bundle on delirium, functional outcomes, and quality of life in critically ill patients, a systematic review and meta-analysis. International Journal of Nursing Studies. 2023, 138:104410. PMID, 365776261. https://pubmed.ncbi.nlm.nih.gov/365776261. DOI 10.1016/J.IGNURSTA.2022.104410. 2. Takuda R. et al. Sepsis-Associated Delirium, a Narrative Review. Journal of Clinical Medicine. 2023, 12/4. PMID 368350809. https://pubmed.ncbi.nlm.nih.gov/368350809. DOI 10.3390/JCM1204127. 3. Latronico N. et al. Improving Management of ARDS, Uniting Acute Management and Long-Term Recovery. Critical Care, London, England. 2024, 28, 158. PMID 383959002. https://pubmed.ncbi.nlm.nih.gov/383959002. DOI 10.1186/S13054-024-04810-9. 4. Engel J. et al. Modified ABCDEF bundles for critically ill pediatric patients, what could they look like? Frontiers in Pediatrics. 2022, 10:886334. PMID 355866826. https://pubmed.ncbi.nlm.nih.gov/355866826. DOI 10.3389/PED.2022.886334. 5. Sherman M. et al. From Resuscitation to Rehabilitation, the Post-Intensive Care Syndrome Continuum in Sepsis Care. Journal of Clinical Medicine. 2025, 14-23. PMID 413756777. https://pubmed.ncbi.nlm.nih.gov/413756777. DOI 10.3390/JCM1423837. 6. Gideon et al. Seeking the Light in Intensive Care Unit Sedation, the Optimal Sedation Strategy for Critically Ill Patients. Frontiers in Medicine. 2022, 9:901343. PMID 358147888. https://pubmed.ncbi.nlm.nih.gov/358147888. DOI 10.3389/Med.2022.901343. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.